Hi, welcome to Facebook Live. I'm Dr. Annette Mercatante from the St. Clair County Health Department.
And I'm Justin Westmiller, the Director for Homeland Security and Emergency Management in St. Clair County.
So we're here to answer your questions, and as usual, we're going to start out with a very brief review of our data. The reason it's going to be brief is because not much has changed. We continue to have an average of about 2.5, 3 cases a day on the average. Some days we have more, some days we have less. But overall, we're not seeing an increase in average daily cases. We're continuing to see a less than 2% testing positivity, although we are seeing a somewhat decreased amount of testing. We are not seeing an increase in hospitalizations, and we have not seen any deaths for several weeks. How long has it been? Like 8 weeks?
Almost three.
Almost quite a long time. So that's all good news. Our graph, our epigraph does show the ups and downs of our average cases. As you can see, we're kind of on a downward slope, but we're also, I believe, kind of stabilizing at this new level of about 2 to 4 new cases per day. So we'll see how that goes over the next couple of weeks. Remember, the incubation period of this virus is 14 days. And assuming that we have a lot of people going back into congregate settings with schools and sports and whatnot, we would expect to see some increases in cases. That being said, we'll talk a little bit more in detail about what that might look like. Yep. And then our next graph is just kind of, again, going through the amount of daily testing we have. And the important part is the stability of the positivity. Most communities that have seen spikes in their cases, these spikes are generally preceded by elevations in percent positivity. So it's one of those things that might be an early warning sign to us if the number of positive tests are starting to creep up, that we may be seeing more positive cases as we go. And finally, just referring back to our website where you can see our day-to-day dashboard. There's also the My Safe Start dashboard, which we are beginning to rely on more and more. That dashboard is going to also include data points that are going to guide us with the school issues and the classrooms, etc. So, with that, further ado, let's start with our questions.
All right, did you want to talk about the Labcore testing?
Yeah.
Okay, so yeah, one of the things we discovered this week as we were continuing to review where lab resources are, where to send people for labs. As you know, there's a michigan.gov/COVID testing site, and on there we found a self-testing resource through Labcore where you can actually register yourself. They will send you a kit to your home where you can send your specimen in on your own. Those results get emailed back to you. They also get entered into our database. We tried it out a little bit with our own staff and found that the response time was 24 hours. So it's an option for those of you who don't have the medical provider. I don't think a medical order was needed, was it?
No. It's not.
Correct? So a medical a physician's order was not needed for this, and you can find this information on the lab testing info on our website as well as on the state's website. So just another option for you.
And we also, I believe, either we're going to put it on the screen or it'll be on the screen after this presentation.
Mm-hmm. So one of the questions was, where can I file a complaint for a facility that is not following COVID safety precautions? We, of course, are getting inundated with concerns and calls from people who are noticing that not everybody is following the rules exactly as they perceive them should be followed. And so you want to call us at 810-987-5300, and we will generate a complaint and put it towards the correct place. If it's a restaurant, our environmental health people do it. If it's medical, our nursing staff does it, etc. There are also multiple sites at the state website, michigan.gov/coronavirus website, and there are multiple places where you can file complaints on that website. So we'll continue to help you with that. So just give us a call and we'll guide you towards the right resource.
Justin,
so the big talk of the day is my first question: how are students involved in organized sports going to manage wearing masks with all their other protective gear? And the governor and her staff were pretty clear today that if you can't create 6 feet of distance in the sport you're playing, other than what's called fleeting moments, you're required to wear a mask. throughout the entire participation of the sport. So right now, it's been laid out pretty clear. That's what the ruling is on the EO, and we'll await any further guidance from the governor and the governor's staff. But that's where we are right now.
Still no questions
Okay.
on the live, but
Let me do you. I got some great questions here in front of me. These come in, by the way. We don't make these up. These are real questions that we have seen that are sent to us through our social media page, right? That's where we get them from.
Hotline.
And
the
online.
hotline,
And
yeah.
online. And on our hotline, which is COVID-19 at stclaircounty.org.
Correct.
So we are getting really great questions and concerns that way as well. That's always a good place to go. So if a parent is tested for COVID-19, does the child have to stay home from school? Now, the question is, if the parent is tested positive for COVID-19 and they are in confirmed case, then that family is quarantined for 14 days. Everybody in that household would generally be quarantined unless there were very specific living arrangements. We do have families that anticipate positive tests and they move people down into the basement or different living quarters, or we evaluate those situations case by case. But say the parent is just getting tested because they just want to. They're not sick. They have, they just want to be sure. Those children would not be quarantined during that time. We don't quarantine people while tests are pending unless we already know that there's significant exposure. So it gets a little murky here. Different people interpret this differently. I think the best way to approach this is, again, we'll wade through this case by case. But I can also tell you that when we have low transmission in our community, we're going to be a little bit more lax with this type of thing. If we start seeing cases starting to go up, we're going to tighten that up a little bit and make sure people do stay home until we're absolutely certain. But in general, if we're waiting for a test, and that test is pending, and that person is not considered very high risk, those exposed individuals around them are not quarantined until we know the results.
Please remind people they can drop their questions in the chat here on Facebook.
Yeah, and please drop your questions on the chat side so we can answer them right now while you have our attention.
And I'll take another question. One of the questions I received today was, for this new Futures for Frontliners program, is this good for anyone wanting to go to college, and what are the specifications? Question, and it's basically akin to a GI program for state residents. Michigan is the first state to do something like this, as it was laid out today by the governor. And so here's some points. You must be a Michigan resident. For the college portion of it, you must have a high school diploma or an equivalent, the GED. You must have worked in the industry. This is where it's going to catch most people. You must have been in an essential industry, at least part-time, for 11 of the 13 weeks between April 1st and June 30th. Obviously, that's when we really got into the meat and potatoes of this. You also have not previously earned an associate's or bachelor's degree and not be in default on a federal student loan. So those are some of the talking points on this brand new program that the governor rolled out today.
It depends.
It depends, right?
It depends.
So in everything that we talk about with
That's right.
coronavirus,
It depends.
It depends. But
there is not much black and white in this situation.
Not at all.
A lot of gray. I can say the only black and white I can say is this virus is real. It's very contagious, and there's a fair amount of people who get it and don't get symptoms, get mild symptoms, but there are clearly people who get very severe outcomes from it. So it does need to be taken seriously, and that's what we're trying to do.
This, and I don't always like to speak for the health department, but I'll tell you that this is the most difficult thing that they've ever dealt with from a resource standpoint and a community public health management standpoint. So, as Doc said, every day is different. No two situations are the same, and we just ask for everybody to be just ultimately flexible.
And although local public health does have authority under the public health code, we're not a military nation. We don't want to coerce and mandate people to do things by force. There's just so much we can reasonably do. So that means most of this compliance falls on all of you to voluntarily decide how to manage this. I'm going to go to some more questions, but the bottom line is if you go into a situation and you observe what you would consider not to be the best risk reduction strategies, are people without masks, they're getting along, take it upon yourself to leave. You please let us know about it. We'll do our best, but we just are having a difficult time forcing people to do things they don't want to do, and that's really not our MO. So take a look at your situation, your surroundings, and you're going to have to make compromises and sacrifices if you really want to keep your risk low, especially in public places where a lot of people have the right to go to.
Right.
All right, so on that, I'm going to say, is it safe to go to gyms and pools now that they were reopened yesterday, I think?
Yeah, that's correct.
So it depends. Okay, so if your gym or pool has criteria in place, for instance, I know the YMCA is planning on doing like a tea time. You schedule one person per lane. They're not doing any more than a number of lanes. I would consider that a reasonably safe thing to do. You walk in with a mask, you walk out with a mask. There's no steam rooms, there's no showers. So there are different situations in different gyms and different pools. Figure out what yours is about. And if you are a person who is at a higher risk, say you're vulnerable with a chronic disease, you're elderly, by that I mean as old as me or older, the 60-year-old range, it's not like you have to be a 80-year-old to be vulnerable to this virus, then really consider what you're walking into. If you're not sure, use your eyes, walk in, take a look around. If it's not to your liking, leave. So that question is it safe? I think there are situations where it will be safe and to your advantage to start moving and exercising again. It's going to help us all with our head and our bodies to start moving again and doing this. But please kind of use your common sense and evaluate the situation, and don't do it if you don't feel comfortable. Do remember that exercise, this is where all this thing about masks and sports is coming in. As you exercise and breathe heavier, the virus is spread further out. So we can't help that. That's the way the virus works. So that's one of the problems in exercise, that 6 feet warning may not always be adequate if somebody's really working out pretty hard and doesn't have a mask on or can't wear the mask or isn't wearing the mask. So you just got to keep those in mind. It is still safer to work out outside. So whenever possible, do your outside workouts as long as we can, weather permitting.
All right. Still no questions on the live. Do
Okay.
you want to do the next?
Yep, I have one more. Can you explain briefly what most Americans can do to help other Americans in time of crisis, right? So you can do things like volunteer, donate blood, donate money to a reputable organization or outfit, support your local food bank, and deliver relief wherever it's needed. So basically it just means be a good neighbor when a good neighbor is needed. That's really the long and short of it.
All right. Do you want to do your last question on your
And
sheet?
stay positive.
Hey, there it is. Yep.
Even
Stay
if you
positive.
don't want to give blood or whatever, being part of the solution means being supportive of the effort. It makes a difference when you wear a mask. It makes a difference when you stay away from crowds. Every time you do that is one less problem that we have on our hands. So be part of the solution, and that will be, I think, one of the best citizen things you can do. And being positive, smiling a little bit, trying to be positive, I think goes a really long way these days. We are all starting to have trouble with this constant, what next, and here's the next thing we got to do.
Yep.
It's important that we hold each other up when we're feeling stressed out. So
Yeah, and we said this a lot, but remember that your neighbors aren't the enemy, officials aren't the enemy, the virus is the enemy, and we all just need to stay focused on that.
yeah, that is a good point.
Yeah.
My next question is a tough one. I'll read it to you. It says, when cold and flu season comes around and we have symptoms, hospital get tested for COVID before going to our regular physician's office to get treated, or should it could be just a sinus infection? In other words, how do we approach this? And as you guys know, in the fall, we get a lot of viral syndromes. It's not just flu. We get adenovirus. We get a variety of viruses that come through generally in the cooler weather. Some cause milder symptoms, but like influenza can cause pretty severe high fevers, worsening cough, body aches, headaches. If you go through that list side by side, influenza and COVID, you're going to see that there's a lot of similarities, with the exception of the shortness of breath and the loss of taste and smell. I think those are only 2 outliers. And so it's going to be really hard to tell the difference, and it's going to be really hard for your physicians to tell the difference unless testing is done. So you're right in the sense that you're going to need some testing, ideally. How that works out, I would prefer you start with your physician. And I'm trying to work with all of our physicians to have the capacity to do that testing. If they don't want to bring you into their office to just kind of order it, we're going to see testing that's automatically going to be flu and COVID. I think we're going to see that pretty quickly as the season rolls out. So you'll end up getting tested for both, more than likely, when you, or even a full respiratory panel. With the kids, it'll include RSV as well. So those tests now, like, you're going to have to go and get multiple tests. You're going to get tested for the biggies all at the same time. So let's start out with your physician. We'll see what kind of barriers. This is another one of those things. We're going to wade through this ourselves. If the resources aren't adequate, we'll just adjust and we'll figure out how to make that more available to all of you. But testing is going to be the key, or you're going to have to assume COVID and stay home for that full 10 days after the onset of your symptoms. Let's face it, flu can last that long as well, too. So it's going to be a little rough. So.
First question on the live. When is a good time to get a flu shot?
Now. When is a good time to get a flu shot? Right now. We're starting to get our supplies in. Pharmacists already have them. Most of our docs are starting to get them in. Anytime between now and the end of the flu season, trying to get most people vaccinated by the end of October, early November, because that's generally the soonest the flu season will start to peak, is November. Some years we have later, like after the New Year's, sometimes as late as March. And some years we get them early. The earliest I can remember is late October, early November. So just to be safe, as soon as you can, this is a good time to get them.
Right. Still no question.
Okay.
Is there anything that we haven't covered yet?
Well, there's this one question, a second part of this question that asked about antibiotics to treat sinus infections. And as you guys hopefully know, COVID is a virus, as is influenza as a virus, and antibiotics do not have any impact on viruses. And one of the things that we're starting to see in the medical literature is that we're seeing a lot more use of antibiotics in a viral syndrome, probably because the offices haven't been open and we don't have a lot of resources to figure out what's going on. One of the problems with antibiotic use and viruses is we see increases in antibiotic resistance, which is where the bacteria that normally would respond to antibiotics don't respond anymore. They get resistant to it. And that's a big problem for everybody. So this is something your physician has to weigh in on. Certain sinus infections are in fact bacterial and do need an antibiotic, and that needs to be addressed by your physician. But the virus itself don't respond to antibiotics, and you should not be prescribed an antibiotic for those. Okay.
Anything that you wanted to speak on that hasn't been covered in the questions yet? You don't have any questions on the
Wow, no questions. Guys, I'm sure you have a ton of questions. I know I do.
Yeah, every
I
day.
have more questions than I have answers for.
That's right.
We'll go back to schools. I think the school thing is huge, right? I mean, we are getting lots and lots of calls and questions about the schools. There is a My Safe Start school document that came out from the governor's office and a think tank that was involved. And it goes through different phases of school openings depending on the community transmission of the virus. So long as we're in phase 4 in St. Clair County because of where our virus transmission is. And phase 4 means we are allowed to have in-person learning, but we can also choose virtual, and I believe all of our schools have given parents a choice to virtual. Not all the school districts have an in-person learning option, but that also requires certain things and highly recommends other things, and there's a long list. But what is required is a mask, unless you have you're medically unable to tolerate a mask, and then you should not be compelled to wear one. And I think what we're seeing is what I predicted, is we're seeing people showing up with medical waivers or exemptions for masks that I would not consider valid, but it is what it is. Physicians have the ability, the legal authority, and the license to write these exemptions. And then people are coming to school without masks. So you got people who are trying to do the right thing and wearing their masks and doing the required thing, and then you have another group of people who aren't. That's going to be a problem, people. It is going to be a problem. I'm saying it right now. It is ultimately up to the school district to decide what to do. And I've said this before, and I'm going to say it again. It is the opinion, it's the expertise opinion of the public health department that if you are not able to tolerate a mask in a congregate setting like a school building and classroom, you shouldn't be there. You should be doing in-person learning. And we're going to stand by that, and we hope that we don't have to eat our words. But this is one of the main things I think we're hearing today, is a lot of people in the schools are showing up without their masks. That is your right to not wear a mask, and if your doc says you don't have to, but you know what? You shouldn't be exposing other people. And I think there is a need at some point where we're going to have to get kind of down to the basics with this, but we'll cross that bridge when we come to it. And how are we going to come to that? We're going to come to that by monitoring cases. We are going to continue to identify and diagnose COVID cases, and there are specific ways we do that. And when there are 2 or more cases in a school, in a classroom, that we can not find any other way that they've been infected other than through each other and through that school setting, that's considered an outbreak. And outbreaks will require a response of a stricter risk reduction strategy. Stricter risk reduction. Everyone wears masks. I mean, there's only so many things you can do. 6 feet apart, barriers. So these are the kinds of things we're going to get to over the next week or 2 weeks. So stay tuned. We'll muddle through this together. Do you have anything else to say?
Yeah, so I like to talk a lot about the community side. Doc is the smartest person I know on the medical side. But what is so important for the community side of this is we're all working hard to ensure that all of our neighbors kind of understand what's happening all the time. And we're doing the very best we can to get that information out every single day to the public when there's a change or when there's a new requirement that requires assistance from the community. I've said this 100 times and I'll keep saying it. This is very difficult. I know it's very difficult on our students. It's difficult on the parents. It's difficult on the teachers and staffs at schools. This is just hard for everybody. And I think, one, our community is doing a really great job, regardless of the negative impacts. And we just need you to keep fighting. I've said this before. We will have a relaxation at some point of some of these rules and regulations. It will get better.
Might get worse before it gets better. Oh, I forgot to mention with the school thing, and I apologize, I didn't mean to interrupt or interfere. But there is a toolkit.
Yes.
That we are relying on, that the whole state is relying on. There's variables to it. There are subjective areas where we can, but that toolkit is posted on our website. It has very clear algorithms about what will we do with a sick kid, what do we do with the kids that are exposed, what if it's a staff versus a student. It's all there for you to review. We're getting a lot of questions that, honestly, we don't mind answering your questions, but it's getting a little hard for us to call y'all back. So please go to our website and take a look at that toolkit. My guess is that toolkit's going to answer a lot of your questions. And then if it doesn't, by all means, give us a call. But start with that, because I think that toolkit's it's been painstakingly reviewed. It continues to get reviewed and updated, and I think it's a really useful piece of information that you can use.
Yeah, it's really a living document, right? So this isn't a cut and dry situation at all. We are learning new things about COVID-19 every single day, and to adjust to those things, it's always going to be an adjustment and slight changes, and that's where we ask again for that ultimate flexibility. And we know everybody's really trying hard to do the right thing.
Got some questions now.
Okay, I stimulated a little conversation. All right, we have a few minutes. Let's go.
What should you do if you go to a business where you see them letting people in with no mask all the time.
So the question is, what do you do if you go to a business and you clearly see nobody was wearing masks and there's nobody there so you report them. Number one, if you don't absolutely need to go in the business, don't go in.
Right.
Don't expose yourself to an increased risk situation. And number two, by all means, report them. You can report them to us. I mentioned that there's a MyOSHA website, there's a hotline, there's a number of ways you can do this. And like everything else, things need to be done multiple times. So if you report them and then somebody else does it later on, and that'll get some attention eventually. Probably more importantly, though, is don't stress you out by trying to go in. Find another place to do your business.
All right, next question. Is there a chance anytime soon that we'll be able to have more rapid results for COVID tests?
So the request is about the time it's still taking to get results back. Is there a time where this will happen? Yes. Anytime soon? It's hard to say. So we're down to, again, about 3 days with COVID results for the PCR. We're starting to see a little bit of this antigen testing coming in. That's a point of care testing. In other words, that's immediate. You'll do the test, and I think it takes about 15 or 20 minutes, and you get a result. So those are becoming more available, and I think that's going to give people a little bit more of a rapid answer, but those tests aren't as accurate, and we can't use those to confirm a diagnosis. It gets a little bit more complicated there as far as what we as a health department need to say, yes, you definitely have COVID. So the gold standard is still the PCR, and if you can, muster up the time to do that, that's the one we're still asking you to do for a diagnosis.
And on that too, know that technology is continually evolving, and we are at some point probably going to get, one, a lot quicker at the test turnaround, and two, some more capabilities such as this in-home option. So science is going to catch up a little bit, and at some point we'll have potentially some better options.
I'll just say the science is there.
Right.
We can, it's possible. The problem is the system isn't there. The system's not in place to process all of these hundreds of thousands of millions of tests. And so the question is, when will the system catch up to the science?
There you go.
That's when you get into a little more complication. The science is easy. There's no question we can do it. It can be done. The question is,
it's the industrialization.
How do we develop it operationally with our community, with the insurance plans, with the cost of it? How do we put all those pieces together so that you can get your test results right away? It's a great question.
We have 2 more questions to cover. I heard that COVID is out of control and contact tracing is useless. Can you respond to that?
COVID is out of control and contact tracing is useless. Well, first of all, I've showed you our data, and I can say that for all intents and purposes, I would consider our data to be very, very clearly indicating that it's not out of control. We are still able every day to identify and investigate every positive case that shows up in our system. If people are cooperative, we can contact all of their contacts, typically within 24 to 48 hours. This is very doable. It really just requires cooperation. And so I would not say that this is out of control or a lost cause yet. It ain't over yet, people. We're gonna fix this, and we're gonna fight it until we win.
All right, here's a data question. Can you tell us, of the people who are newly infected, what ages they are? Like 4 new cases, 2 in their 20s, 1 child and 1 in their 40s. Just wondering what age groups currently are being infected.
Okay, so we broken down on the first page of our data.
Yep.
This is kept up to date. It's a rolling 7 days, so as it changes, but it is described in percentages, so you can see all age groups. I don't know. Do we know the youngest to the oldest age groups? Well, while Brandon's looking that up, I can tell you that all age groups are getting infected. Because, especially since late July, August, we saw a much younger demographic getting infected. I've mentioned before, I think that's partly why we're not seeing so many hospitalizations. We continue to see the majority of people getting infected under the age of 50. Okay, so we can break it down into actual ages. Like everything else, if we have 1 case in a certain age, we're not going to say, oh, we have 1 3-year-old, because that would identify the 3-year-old. So we try not to do that. But I would say that all ages are vulnerable. It's really rare in those really young, under 1 year of age. I don't know that we've had any cases under that age, have we? 2 under the age of 1? So there you go. So I'm sorry, but there is no age group where you're completely not susceptible. And I hope I answered your question. I'm not sure what the intent behind that question is, but if you write back, maybe we can get a little more specific.
Okay. Any closing comments?
Oh, closing comments. Guys, just keep your chin up. This is going to be a rough week, I think. It's going to be a rough couple of weeks. It's not the worst. We're going to do better, but I just want everybody to know that we're here doing our job. We are not overwhelmed. We are able to keep up with every positive case and their contacts. We're building our repertoire of support services, and we can do this. We can do this better if all of you help and cooperate, and that's why we're here talking to you so that you understand. The better you understand things, the more you can help. So keep those questions coming in, and we'll keep being here to answer them.
And not only is this, we're gonna see some things happen, but we're gonna learn a lot in the next 2 weeks to a month and understand how the interactions are going versus what the community spread is and things like that. So yes, it's gonna keep things pretty busy. It's gonna keep some uncertainty in the air, but I'm asking everybody just to look past the uncertainty and understand that there's some really good professionals managing the situation, and we're doing as much as we can to be as transparent as possible to ensure that everybody can kind of understand what we're doing, when we're doing it, and how we're doing it. So like Doc said, hang in there, and I think we'll see you next week.
In through your nose, out through your mouth. When in doubt, breathe in and out.
Yep.
Calm yourself down. See you next week.
Thanks, everybody.